Module 1, Introduction. NeoMed welcomes you to the NFIT workshop. We are here to review common changes associated with NFIT conversions and how these will affect each area in the hospital from pharmacy to NICU. We will follow the milk each step of the way to show how NFIT impacts collection, storing, filling, and dispensing of nutrition, as well as medication for both the neonatal and adult patient. NeoMed makes posters available for NeoConnect conversions for your NICU, milk prep rooms, pharmacy, and adult ICUs to help remind clinicians about key NFIT changes. This helps staff remember these processes until they become second nature and everyone becomes comfortable after the initial transition to NFIT. NeoMed products frequently reference third-party recommendations and position statements from GEDSA, ADA, ASPEN, FDA, and the Joint Commission. Transitions to NFIT are expected to follow timelines recommended by GEDSA in their August 2016 position statement. Conversion to enteral devices with NFIT connectors impacts the entire enteral feeding system across all healthcare settings. To avoid disruption of therapy, a careful and methodical transition is recommended over the course of 2016 and 2017 throughout the world. This is the current NeoMed enteral-only system and connection. You have an enteral oral male syringe tip that connects to a female feeding tube using a friction fit that is easy to clean. This has been a standard in the industry for years. This is the standard NFIT design recognized by GEDSA, which meets the new ISO 80369-3 small bore connector standard for enteral devices. There are some key differences. It has a larger female syringe tip that will twist down onto a male feeding tube hub. The male hub has a deep moat that can easily accumulate breast milk. Pooled breast milk can begin to colonize with bacteria in as little as 4 hours. This typical configuration raises questions about cleaning procedures since in most protocols, the feeding tube stays in the patient for 7 to 10 days, but can stay up to 30 days if made of silicone or polyurethane for long-term situations. Now I would like to show you the NeoMed NFIT design that we call NeoConnect. NeoMed created a patented hub design that both meets the standard and accommodates the unique nutritional delivery needs of the neonatal patient. NeoMed NeoConnect syringes feature offset NFIT tips along with an O-ring plunger. Offset tips and O-ring style plungers have been shown to deliver more fats and lipids and therefore more calories than center tip syringe designs with rubber tip plungers. The NeoConnect syringe female tip has fewer grooves or threads than the standard NFIT tip that may collect milk or medication. This thoughtful design may help make direct oral administration easier. The NeoMed feeding tube has a unique patent-pending bottomless hub that helps mitigate pooling or collection of HBM that may colonize with bacteria. This open design also allows for a proprietary cleaning tool to assist with cleaning protocols. Remember the phrase, "Inspect before you connect." Thread cleanliness, pooling risk, and risk of bacterial proliferation should be considered to ensure that established protocols are appropriate for neonatal needs. Dosing accuracy is of particular concern in low-volume doses. NFIT syringes come with 2 types of tips. Smaller volume syringes, 5 milliliters and under, should feature a low-dose syringe tip. Larger volume syringes typically feature the standard NFIT tip. As you can see, the NFIT standard tip generally has more priming volume than your legacy enteral-only syringe tip. GEDSA recommends that syringe sizes 5 milliliters or less should have a low-dose tip to ensure small volume dosing accuracy. Many hospitals develop dosing protocols in accordance with GEDSA recommendations for dosing 5 milliliters or less with the use of an NFIT low-dose tip syringe. NeoMed designed our low-dose tip syringe with an inner lumen that is similar to a Luer lock connector. Through independent third-party labs, GEDSA has demonstrated that the low-dose tip syringe is just as accurate as legacy syringes and is, in fact, more accurate than other proprietary non-ENFit female tip syringes on the market today. NeoMed provides the low-dose tip syringe in half, 1, 3, and 6 milliliter sizes. GEDSA reminds us in their November 2015 position statement, a successful transition will include the use of ENFit connectors on all components of an enteral feeding system. Feeding tubes and medication ports on feeding sets with the new ENFit male connectors will require new female ENFit tip syringes. Syringes for flushing, hydration, bolus feeding, and enteral administration of medication are critical to support the introduction of feeding tubes with the ENFit connectors in healthcare setting. Let's follow the milk and follow the medications to see how ENFit impacts collection, storage, filling, and dispensing of nutrition and medication. Every time an oral tip syringe was used previously, an ENFit syringe will now be needed. Module 2, Collection. Transition to ENFit must consider breast milk collection, storage, dispensing, and any potential impact on aseptic handling practices advocated by the ADA. Improper handling and storage may result in volume, lipid, and nutrient losses, as well as contamination. Collection should occur in ENFit-compatible devices that provide aseptic handling and preserve precious nutrients. NeoMed has a family of containers in various sizes that include ENFit-compatible transfer lids. NeoMed bottles are universally threaded, so mom can pump directly into them from most breast pumps. The transfer lid will allow for easy transfer from a storage container into a syringe for gravity feeds, pump feeds, colostrum dispensing, or oral, trophic, or VAP prevention care. The NeoMed family of containers are available in a variety of sizes, including commonly used 1 and 2 ounce capacities. The NeoMed collection system is the first to offer a container packaged with a transfer lid. Additionally, our containers feature black silkscreen markings that make it easier to read. NeoMed 1 and 2 ounce containers have concave bottoms designed specifically for off-center tip syringes to help reduce any fluid loss. NeoMed small volume containers also are designed to minimize the risk of rolling when stored on their sides. For bedside collection or oral dispensing to a baby, NeoMed recommends using our DoseMate or DoseMate DL. They attach directly to a NeoConnect syringe and provide greater comfort to the patient. Next, we will follow the milk and follow the medications to show how the ENFit transition minimally impacts filling both in the pharmacy and the NICU. Module 3. Filling for the NICU. All processes that require ENFit syringes to be filled with nutrition for gravity feeds, pump feeds, trophic feeds, colostrum care, and VAP prevention care should use an ENFit-compatible transfer lid. NeoMed has designed a transfer lid that will enable a NeoConnect syringe to fit onto and fill the syringe in an easy manner to help minimize loss of precious nutrients while supporting closed systems and aseptic techniques described in ASPEN and ADA guidelines for milk preparation. NeoMed provides NeoConnect straws for filling a syringe from a proprietary bottle that is not universally threaded. It is best to wear gloves when preparing all nutrition, either in a milk prep room or at the bedside, to help maintain aseptic technique. When filling a syringe for gravity or pump feed, take the syringe and tip cap out of its sterile package. Connect the syringe tip to the transfer lid so the tip is pointing down. Next, invert the bottle and syringe and be sure to position the syringe vertically with the tip up and the bottle completely inverted. Pull the plunger down to fill the syringe to the desired volume, plus a couple of milliliters more, while still in the inverted position. Then flip the bottle and the syringe back around so the bottle is upright on the table and the syringe tip is pointing down on the bottle. At this time, and only in this position, push any excess volume back into the bottle to achieve the desired volume. Disconnect the syringe from the NeoConnect transfer lid. With one hand, snap the syringe tip onto the click-to-close self-righting tip cap to transport to the bedside for feeding. A NeoConnect low-dose syringe should be used for trophic feeds or VAP prevention care. Low-dose syringes can be filled by using the NeoConnect transfer lid or a straw, depending on what type of container is being used. When using a straw, connect the straw to the end of the syringe by twisting. Place the tip of the straw into the container and pull the plunger back to fill the syringe. The syringe plunger can be cycled to remove air if necessary. Disconnect the syringe from the straw and apply the click-to-close self-righting tip cap by snapping the syringe tip onto the cap to transport to the bedside for feeding. Colostrum is frequently collected in a 1-ounce colostrum container and must be removed for oral therapy and colostrum care. To accomplish this, use a DoseMate DL with a low-dose tip syringe. This can be done at bedside and immediately delivered to the baby. Module 4. Filling for the pharmacy. Medications for enteral or oral delivery in the pharmacy will need to be filled using an NFIT syringe. NeoMed offers NeoConnect bulk syringes in clear and amber. GEDSA recommends that syringe sizes 5 milliliters or less should have a low-dose tip to ensure small volume dosing accuracy. NeoMed offers NeoConnect low-dose tip syringes in half, 1, 3, and 6 milliliter options. Filling operations require all medications to have NFIT-compatible bottle caps and/or NFIT-compatible straws. NeoMed designed medication bottle caps in various sizes to fit most medication bottles, and straws in several lengths to provide for different methods to fill medications. A fill cap coupler has been designed to allow use of legacy fill caps with oral connectors to an NFIT-compatible tip when no NFIT bottle adapter is accessible. If you need to transfer medication from one syringe to another, use the NeoConnect syringe-to-syringe coupler. To fill medications, connect the syringe tip to the bottle cap in a tip-down position. Next, invert the bottle and syringe so that the syringe is in a vertical position with the tip up, while the bottle is completely inverted. Cycle the syringe plunger a few times to help remove air. Pull the plunger to fill the syringe to the desired volume while still in the inverted position. Then flip the bottle and the syringe back around so that the bottle is upright on the table and the syringe is tipped down on the bottle. Disconnect the syringe from the bottle cap. With one hand, snap the syringe tip onto the self-righting click-to-close tip cap to transport for delivery. If desired, the tip cap can be manually screwed onto the syringe tip. NeoMed plans to offer a tamper-evident cap for NeoConnect pharmacy syringes that can be applied for narcotics or other medication doses where appropriate. Module 5. Dispensing nutrition and medication at the bedside in the NICU. Always follow hospital protocols to verify dosing prior to delivery. We have followed the milk throughout collection and filling. Now, we will demonstrate NFIT for dispensing nutrition and medications. All feeds, including gravity feeds, pump feeds, trophic feeds, and colostrum or VAP prevention care, should be dispensed using an NFIT syringe with an NFIT feeding tube or directly into the mouth of the patient using an NFIT-compliant device. All pump feeds should be dispensed by a dedicated enteral-only pump to ensure safety and compliance with Joint Commission recommendations stated in the Sentinel Event Alert. NeoMed offers NFIT feeding tubes specifically designed for neonatal patients. NeoConnect hubs feature a bottomless design to help reduce the risk of breast milk pooling and bacterial colonization. Standard NFIT feeding tube hub design has a deep, closed moat, and may provide a perfect environment for fluid to collect and debris to accumulate. NeoMed has a cleaning tool designed specifically for use with our open hubs to help remove debris, nutrition, or medications that remain in the connector threads. Always inspect before you connect by checking all end-fit connectors for residual material prior to use. Clean if needed. NeoMed syringes feature off-center tips and O-ring gaskets to maximize fat and lipid delivery to the patient. NeoMed syringe designs have been shown to deliver significantly more lipids than competitors with center tips and rubber plungers. About half the calories in breast milk come from the fats, and reducing fat loss is critical for neonatal growth. Let's take the syringe we prepared earlier and dispense using the dedicated MedFusion 3500 with NeoMed syringe library. NeoMed NeoConnect syringes are fully characterized on all MedFusion 3500 or 4000 pumps with version 5 or 6 FarmGuard software. This is the most commonly used enteral syringe pump in the United States. NeoConnect is also characterized for use with the ABC pump. Remove the tip cap and connect the syringe to the extension set by twisting into place. Remember to inspect before you connect. Attach the extension set to the feeding tube by twisting into place. Use caution not to over-tighten. Load the syringe onto the MedFusion 3500 with the tip positioned up, that is, in the 12 o'clock position, to deliver the lipids more efficiently. The pump will acknowledge the syringe as a NeoMed syringe and the size you are loading. For example, this is a 20 milliliter syringe and the screen shows it as a NeoMed 20 milliliter syringe. The feed is now ready to deliver. After the feed has ended, disconnect. Inspect the feeding tube hub and clean if needed. To clean, insert the cleaning tool plug into the hub of the feeding tube by placing the forefinger on the end of the cleaning tool and pressing into the hub. This plug will help prevent any debris from contaminating the pathway to the patient. For easier removal when done, be careful not to over-insert the plug. Next, if desired, use the slots on the cleaning tool to apply sterile water or appropriate cleaning fluid as per hospital protocol. Grab the housing of the cleaning tool to slide it down so the brushes engage the threads of the feeding tube hub. Don't fully insert just yet. This will come in the last cleaning step. Gently rotate the tool 360 degrees until all internal surfaces have been cleaned. Now, fully insert the brushes into the hub until the tips are visibly protruding out the bottom of the hub and wipe away any expelled debris. Gently rotate the plug to loosen its connection within the feeding tube lumen. Retract brushes by pulling back on the housing, taking care that the plug is removed last to protect the patient pathway. Discard the cleaning tool according to hospital protocol. Gravity feeds are easily done with a NeoMed NeoConnect 20 milliliter Gravity Pro syringe. It helps promote a more closed and aseptic technique as recommended by ADA and Aspen guidelines. Remove the tip cap and connect either to the extension set or directly to the feeding tube. Gently pull the plunger up into the vent zone so that the syringe is vented and fluid will flow to the patient. Do not place the syringe in the horizontal position when the vent zone is active or the syringe will leak. The Gravity Pro has a built-in hanger allowing it to be hung outside the incubator. Please always remember to inspect before you connect your gravity feed to make sure there's no debris in the hub. If there is, follow the cleaning process described earlier. Dispense low-volume medications into the feeding tube or extension set using a low-dose tip NeoConnect syringe. Remember, GEDSA recommends that syringe sizes 5 milliliters or less should have a low-dose tip to ensure small-volume dosing accuracy. Remove the tip cap and attach the syringe to the feeding tube by twisting into place and then dispensing the medication. If you are preparing and pulling up medication at bedside for immediate direct oral delivery, use a DoseMate or DoseMate DL to place directly into the mouth or cheek. Trophic feeds, along with colostrum or VAP prevention care, should typically be administered with a NeoMed low-dose tip syringe. Use a swab, a DoseMate, or a DoseMate DL to dispense directly into the mouth or cheek of the patient. Twist the tip cap off the syringe and then apply a small amount of fluid onto the swab. Swab the patient's cheek to administer. The DoseMate or DoseMate DL can also be used to dispense into the patient's mouth or cheek. We have followed the milk from collection to feeding and followed the medications from filling to dispensing. You are now ready to start your transition to NFit and NeoConnect.